First tonight, the holidays have brought what experts feared, another surge in COVID-19 cases.
And Georgia's ICU beds are filling up, the state reporting a record number of patients needing medical care today.
Let me tell you what I've been focused on today, and I think is what the people of Georgia want me focused on, and that is making sure if they need a hospital bed, they're going to get one. We're seeing our hospitalizations increase at an alarming rate right now. As you know, we're working frantically, as we talked about yesterday, to get the World Congress Center facility back opened up.
Today, the Department of Public Health reported 375 new patients, bringing Georgia's total to more than 4,500 current hospitalizations. So for some perspective here, that's 133% higher than it was back on Thanksgiving. And cases remain high, with more than 5,400 new ones reported today, not including the nearly 4,000 probable cases from antigen tests. Our weekly average for new cases is now up to nearly 5,000 cases per day. As our Paulo Ciro explains, hospitals are worried things are only going to get worse.
Vaccines offer a light to the end of the COVID-19 tunnel, but I spoke to the chief medical officers for Wellstar and Grady, and they both say that glow is fading as numbers rise.
I don't see any light right now. I think that Christmas is going to bring just another increase in people who became ill and have to come to the hospital.
The fear of another COVID-19 surge has come true, with cases spiking on Christmas Eve, and now that's starting to be reflected on hospital ICU bed space. Currently, more than 2,600 ICU beds are being used up in Georgia. That's nearly 89% of all ICU beds in the state. It's the highest it's ever been during the pandemic.
Sadly, things have gone the way we feared. We have had a huge increase in the number of patients that have come to the hospital that require critical care.
Grady's chief medical officer, Dr. Robert Jansen, says they're running over 100% capacity in their critical care units while simultaneously dealing with exhausted staff and nurse shortages. A similar story to what Dr. Vic Reddy is seeing at Wellstar, where they're close to reaching capacity.
We're full, so you may be actually in kind of a holding pattern for some time. What you'll see is basically longer kind of wait times to be seen. And that is the kind of, that is the stressor that it puts on the health system.
Dr. Reddy says that in addition to more COVID-19 patients, some hospitals, including theirs, are also dealing with the flu season and routine urgent procedures like heart attacks, strokes, and appendicitis.
The bottom line, okay, unfortunately, is because we are tapping out with resources, we do have to actually occasionally rely on more waits. So you may go to an emergency department and have to wait longer to be seen as we actually deal with these capacity constraints.
Hospitals are trying to juggle being overwhelmed while still vaccinating their staff. Coming up at 6, we talk about the latest on vaccinations for both health systems.
We follow the latest COVID-19 numbers and trends every day here at 11 Alive, and we also break them down by county. You can find those numbers over on 11alive.com.